Broadcasting from Detroit's Cass Corridor, it's the Metro on WDET. I'm Robyn Vincent.
And I'm Tia Graham. Today's show looks at how change takes shape through policy, through protests, through the built environment around us.
We begin with public health. As federal recommendations evolve and trust remains fragile, local health departments are doing quiet, critical work.
Then we turn to protest. All weekend, people nationwide here in Metro Detroit mobilized against immigration enforcement. We'll ask what history tells us about protests that lead to change.
And in the second hour, we step back into Detroit's story. Tyree Guyton reflects on 4 decades of the Heidelberg Project.
And what it means to fight for a neighborhood with imagination. We'll also explore the legacy of Albert Kahn,
the architect whose factories, offices, and civic buildings helped shape Detroit as an industrial capital.
Power, persistence, and the forces that leave a lasting mark. This is the Metro.
We begin in homes, classrooms, and workplaces across Michigan. In all these settings, people are affected by decisions made by public health departments, the agencies that work to prevent disease and keep people healthy. This is a tense moment for public health in America. The COVID-19 pandemic deepened mistrust in the system, and that trust remains fragile. That moment led to the rise of Robert F. Kennedy Jr., a longtime vaccine skeptic who leads the U.S. Department of Health and Human Services. He's promised to make America healthy again. His agenda has included rolling back vaccine recommendations and changing federal nutrition guidance. Some of those changes are welcomed by public health experts. Others raise concerns. These changes have us wondering, do local health departments face unprecedented pressure to work without the support of the federal government? To find out, we begin our monthly series with Kate Guzman. She's Oakland County's health officer. Kate, welcome back.
Thank you. Good morning.
So first, local health departments and federal guidance are not in lockstep anymore. Kate, this seems like an unprecedented moment. Major health guidelines used to come from the federal government and local departments would follow it. Is that right?
Correct.
So is this moment unprecedented?
It is. As a public health professional, I've always leaned on the CDC, the Centers for Disease Control, to be our experts that are providing the guidance, up-to-date recommendations. And now that's not our go-to anymore. We're very fortunate in Michigan that our health officer for the state of Michigan, Dr. Bagdasarian, is really leading the way. The state health department is doing an incredible job taking a strong stance and providing support to local health departments. And I know it's not that case in every state, but here in Michigan, we are very lucky. We are in line with the state in saying, we've got these amazing academic institutions that we can rely on. We don't have to go to the CDC. We've got the American Academy of Pediatrics and family practitioners and OBGYNs, right? We've got all of these resources and we can lean on them instead.
But it sounds challenging in that this is more piecemeal now, as opposed to being able to look to this one central agency, this one force, and now it's more looking to the state and looking to some of these professional, trustworthy groups.
Definitely it is. And piecemeal is a great word. I think the role that the local health departments can play is to create a cohesive message and have a platform in our offices, on our websites, on our social media, so that families don't feel like it's piecemeal, so that they still feel like there's continuity in messaging from the state level and from the local level.
So does that mean that you're working more closely with other health departments now than you did before?
Yes, I think the state calls that we have as health departments are crucial now, just like they were in COVID-19. I do think that the pandemic brought us together in a way that we hadn't seen before, or maybe not since other smaller epidemics or outbreaks, right? But during the pandemic, I think it taught us the importance of coming together on a regional level, on a state level, and even on a national level. And so these state calls that we have there are essential to make sure all the local health departments are hearing the same message. We know, especially in the Metro Detroit area, that our customers, our clients, our patients, they're crossing borders to go to work, to school. Where they live is not necessarily where they're seeking healthcare. And so we really look at public health as a regional approach. Public health has no boundaries. And so if there's a case of measles and it's on one side of 8 Mile, there's nothing to prevent it from crossing over to the other side of 8 Mile.
Yeah, that's something that I think really hit home for a lot of members of the public is the idea that there are no boundaries.
No borders.
Before we look more deeply at how you're approaching this moment, Kate, I want to take a quick snapshot of people's health right now during this season of winter illness. We're seeing flu, COVID, RSV, strep, and stomach bugs circulating at the same time. Who's feeling it the most right now?
Honestly, it's our most vulnerable elderly seniors that are really hit the hardest by most of the respiratory viruses. And so we see illnesses and hospitalizations in the youngest and the oldest always because of just their immune systems and their state of health in general. But when we really think about impact on our community members, it's not just the most vulnerable in terms of ages, it's also the most vulnerable in terms of socioeconomic status. And we're thinking about access to care, access to preventive care on the front end, having access to those vaccines and just a general state of wellness. But then on the other end, access to the ability to work from home when you're not feeling well, the ability to seek early treatment so you can get on an antiviral for influenza, for example, right? And so someone who doesn't have the flexibility to call in sick to work, doesn't have a leave bank of vacation time, they will be so hesitant to miss work that they'll wait until they are very, very sick to seek care. And so they will have a worse outcome. They'll have a more severe illness because of the length of time that they've waited. It will be too long for antivirals. And by then, that's when we see some hospitalizations in younger individuals that typically aren't in that infant or elderly age range.
So you're saying the guidance that we have long heard, stay home if you're sick, has really missed something about how people actually live and work in Oakland County?
Yeah, I mean, that guidance of staying home if you're sick really only applies to those of us that have the luxury to do so. And so there's so many people out there that can't keep their kids home from school when they're sick because they don't have daycare easily available to them. And so those are the families that if you wake up and your kid has a headache or maybe a little bit of an upset stomach, maybe a low-grade fever, give them some Motrin, get them out the door, get them to school because school is a safe place for them today where they're getting 2 meals a day, because there's no option. Those are families that are more likely to go to work when they're sick, like I said, and wait until the absolute last minute to seek care because calling into work has repercussions for them.
So it's much more now about sending out messages focused on preventative measures that can be taken because you're acknowledging more and more that there is this luxury to staying home if you're not feeling well. And there is a huge disruption for folks when, let's say, kids are sick, parents are sick. And so you're trying to view things in a more holistic way.
Definitely. I mean, prevention starts at the very beginning with vaccination. And so thinking the importance of vaccination just ahead of time. And so taking those moments before a respiratory season hits to get vaccinated is the first step in prevention. But then our basic just infection prevention components. So thinking about wearing a mask. Masks seems to be a dirty word since the pandemic. People don't want to talk about masks and people are stigmatized for wearing masks in public, but I applaud those of you that are wearing a mask if you're sick or wearing a mask if you're immune compromised and want to protect yourself.
I was just wearing a mask yesterday to visit someone in the hospital, and I remembered the feeling of safety that wearing a mask provides. It just made me feel like I had this, because I did, I had a shield on. I had something protecting me from all of the unknowns. You know, I think a lot of people feel the COVID effect when you're on an elevator, for example. I remember those days during the pandemic when we were in close quarters with one another and we knew that that was a really risky thing and that everyone should be masked if they can't keep distance from each other. And I still have the residuals of that when, like I said, I'm on an elevator and having that mask gives me some level of comfort and safety. I wish that masks were a little bit more socially acceptable.
Yes, like our security blankets. I love that concept.
I'm glad you brought up vaccines as well, because I do want to move on to talk about them. The pressure we discussed to keep working when you're sick, it's landing on families at the same time that they're being asked to make decisions about vaccines. And at the federal level, I'm wondering what has actually changed around vaccine recommendations and what hasn't.
So it's really interesting because conceptually there's been a large change where the CDC has removed vaccines from the recommended schedule and moved them into a category called shared clinical decision making. So conceptually it's a large shift in how we view vaccination recommendations. On the ground level, for those of us actually vaccinating, not much has really changed. We are still recommending all of the same vaccines for families, especially at Oakland County Health Division. Our recommendations haven't changed. We haven't taken any off of our recommendation list. But what it's come to, I think, is that the pediatricians are bearing the burden of this now. And so we've got this idea of shared clinical decision making, which means that you're having an in-depth conversation with your provider. Now, in the health department side for nurses, we've always done that. We take a lot of time with our patients. We're not in a big hurry like a pediatrician is. So you get into a pediatrics office, they've got one patient scheduled every 15 minutes. And the scope, the breadth of what they're covering in a well-child visit is vast. Imagine they're talking about everything from nutrition and growth to safety and seat belts, car seats, bike helmets, to vaccines, to sexual health. I mean, the scope of what they're covering in 15 minutes is enormous. And so something you mentioned at the very beginning, that public health is working behind the scenes. I want to highlight a piece of public health that nobody really sees on the public side is our provider support. So we have programs that are called immunization action plans and a whole unit of nurses that support vaccinating providers in the community. So we're the team behind the scenes that are helping them keep their inventory up to date, keep their inventory of vaccines safe in terms of temperature ranges and expiration dates. We're providing education, monthly in-services to make sure they're up to date on the most current recommendations. Right now, we're encouraging pediatricians to really lean on the AAP, the American Academy of Pediatrics resources for billing, because pediatricians can bill for vaccine counseling even if a vaccine hasn't been administered during that visit. So it's a way for pediatric offices, especially small practices that are struggling to survive, those small kind of mom and pop shops, those pediatrics offices, they're getting few and far between. They're struggling. That billing is essential to their existence. So resources like that, making sure that they know the codes to bill, how to utilize that, how to leverage that funding, that's something that we're doing behind the scenes so that our providers can stay afloat and we can continue to encourage vaccine provision across the county.
Why is that important? I mean, what does that mean exactly in practice, the billing aspect of this?
Yeah, so if you spend 15 minutes in a normal visit and you've spent 15 additional minutes talking about vaccines because the family had a lot of questions, you can bill for your normal visits, and then on top of that, bill an additional code that provides you with an extra amount for that visit. So
billing to the insurance company.
The insurance company. I'm so sorry. I should have clarified that. Yes, these are insurance billing codes, Robyn. Yes, absolutely. The patients wouldn't see this. This is just a way to be compensated for extra time spent talking about vaccines for this shared clinical decision making.
And when you talk about working with pediatricians, I mean, I realize you're taking a different approach in Oakland County when it comes to vaccinations. It's no longer all or nothing, asking parents to follow a vaccine schedule to the T. It's now about meeting people at their comfort level. What does that mean? Give me an example of what that looks like. Walk me through, say, one conversation, one parent, one clinic.
That's a great question. I actually sat in on a vaccine waiver session on Friday afternoon because I had a little free time and I like to stay in touch with these conversations. And I sat with one of our incredible vaccine waiver nurses. So the waivers are the vaccine exemptions that families request if they have vaccines that they don't want their children to get, but still want them enrolled in public school. So you need to come into the health division and have a vaccine waiver if there's not a medical reason. So if you have a philosophical or religious reason why you don't want your child vaccinated, come into the health department, you meet with one of our amazing nurses and have a discussion, have a dialogue. We pride ourselves on de-escalating any tension or mistrust when families come in. Typically, families come in and they're kind of ready for a fight. I'm not going to lie. They've read a lot online on what a waiver session is. They think they're going to be scolded or reprimanded or lectured. And so our nurses are great at de-escalating. The nurse I was working with told me a story about a gentleman that came in, and he said, I'm here because my wife couldn't handle the stress of coming in. And the nurse said, well, what do you mean? He said, well, I'm the muscle. And she said, oh, are we going to arm wrestle today? And he chuckled and settled in, and they had a great conversation because it's not a battle. This is just a conversation. It's a chance to ask questions, get great information and facts, and from a reputable source. There's nothing in it for us to fight about this. We really just want to make sure that all of our families have the best information because we all have the same common goal, which is to protect your children.
I'm wondering, as briefly as you can, how this approach is going. Do you have any data points you're keeping?
Yes, it will. Unfortunately, with data, it takes a while to show real results, and so tiny percentage points, they take time to see. I will say, in any given day, on Friday when I was in the waiver team area, 2 different families in that afternoon had decided to convert from a waiver to vaccinations. That's 2 families in, say, 9 that had appointments that afternoon. I think it's a pretty good show of our success rate.
Yeah, that's reaffirming of this work. It's the Metro on WDET. I'm Robyn Vincent. My guest is Oakland County Health Officer Kate Guzman. We're talking about the ways local health departments are taking on more responsibility as federal recommendations loosen and change, and the unseen work public health departments provide. Now, Kate, a big part of this conversation is, again, RFK Jr., who's been making cuts in the public health arenas of the federal government. 4 months ago, RFK Jr. sat before a Senate committee about him firing people at the Centers for Disease Control. Here is a back and forth between RFK and Colorado Senator Michael Bennet.
We are the sickest country in the world. That's why we have to fire people at CDC.
On behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time.
Now, RFK Jr.'s work is a product of the COVID moment, where trust in public health departments really plummeted. Now, he believes that he's offering more honest public health leadership. And it feels really complex because some of the things that he's pushing for, I know a lot of public health experts are in favor of. And then many of the other things they are up in arms about. What do you make of what he's been doing?
It's so interesting because we may share a desired outcome where I also agree that we should have a higher life expectancy across the United States. For being such a wealthy nation, we should be living much longer. So essentially, I agree with what he's saying. It's just the way that they're going about it is really detrimental to public health. It's detrimental to our programs, our funding, as well as the trust from the public. And to be honest, the trust in the community is really what keeps public health strong, because most of what we're doing is education and communication. It really requires that consistent messaging across all levels, so state, national, right, federal. If we're inconsistent, then the message just gets diluted. People are confused. They're not sure what to do. No one's in line. And that's when we start to see things like vaccine hesitancy just skyrocket. So because people are afraid, they may have already been doubting. And now this inconsistency in the messaging is just really reaffirming what they feared deep down, right? And so, so it's just leading to this growing, it's an epidemic now, vaccine hesitancy.
You would call vaccine hesitancy an epidemic?
Absolutely.
So this moment of great fragility for the system of public health has it has reached a crisis level. And you would say that something fueling that in this moment is this the contrast between federal guidelines, what we're hearing from voices in Washington, D.C., versus the science and versus what local and state health departments and professional groups of healthcare workers are saying.
Absolutely. We were ripe for this coming out of COVID because there was so much mistrust from the public. Yeah. And what we really needed coming out of COVID was a strong, unified platform in public health. It was the only way to recreate the trust that we had previously. And instead, right on the precipice of crumbling, instead of having a unified message, we come in with this chaos. It's been very detrimental. An example of this is just thinking about flu vaccination rates. So in 2019 and 2020, that fall, winter, right before COVID really struck, 64% of Americans were vaccinated against flu. Okay, 64%.
And this was in 2024.
This is 2019.
2019.
So right before COVID. Yeah,
okay,
2019, 2020, that fall, winter of COVID, when COVID hit. Now we're at 43% nationally. So a drop from 64% pre-COVID down to 43% are trusting the flu vaccine to protect them against illness.
That's an enormous decline by any measure.
Mm-hmm. Yeah, it's profound. I mean, honestly, we've seen 10,000 deaths nationally from influenza this year.
What do you think it's going to take to really change, to put a dent in what you are calling the epidemic of vaccine hesitancy?
Honestly, Robyn, it's going to take years. I firmly believe this. Public health typically sees kind of dips and valleys. We see this over time depending on who's in political power. Honestly, we do. So we're used to this. We're just in a huge dip right now. It's going to take several years to come out of this. And that will just be attributed to the work at the local and the state level, just really working hard with communication and getting into the communities, using trusted messengers, even more than we were doing in COVID. It's more essential now, just the work that we're doing. We can't sit in our offices. We can't be in an ivory tower. We have to be out in the community talking with people, really understanding their fears and understanding their hesitations so that our communications are truly aligned with what they need to hear.
Kate, this is something I realize that you're doing quite a bit, keeping your finger on the pulse of the community. And it has me thinking about something else that's being described right now as a chaotic moment. People in Southeast Michigan and across the country are feeling unsafe as they see images of federal immigration officers hurting and killing protesters and approaching people's homes in full combat gear. I want to think about two ways this is affecting folks. First, how are you seeing it affect the mental health of the community?
Interesting, because it's affecting the mental health of different populations in different ways. And so thinking about immigrants themselves and how they're impacted, it could be very different than many of our listeners who are watching what's happening and feel so much empathy for the community that's greatly impacted, right? So we're seeing it on two different levels. In the immigrant community, I don't think it's a secret that they are fearful to leave their homes. Mm-hmm. And so the idea of preventive health care has just gone by the wayside because they've moved to survival mode. And I'm very concerned about the impact that this will have on public health in the upcoming months and the upcoming years. We won't see it immediately, right? All of this takes time to really see the true effects of it. I think who's feeling it right now are schools with attendance rates. So schools that have high immigrant populations are seeing horrifying attendance rates. Again, everything with preventive medicine is early treatment, early identification, just being proactive. And when someone is scared to leave their home, scared to go to a community agency or a government agency, they're not getting their preventive checkups, they're not getting their prescriptions, they're not enrolling in health care because they're fearful that their information will be sent to ICE. On the other side of it, for those of us who work in health and human services, I can speak more directly to that for sure. We feel this deeply because we are in a helping profession. We're in this profession to help every human, not specific individuals, not specific types of people. And so we're seeing a lot of fatigue, stress, and anxiety in those of us in health and human services. Honestly, it's difficult to stay focused on your work because you wish you could do more, you want to do more. And so we're trying to mobilize in the ways that we can. Just as an example from our end, I'm really looking at how I can get more of our services in home. So rather than our traditional homebound definition, which is usually vulnerable and elderly seniors, people who are disabled, typically can get homebound services from us, I'm looking at how do I expand that? How do I screen people so that I'm accurately capturing a family that might need homebound services and might just need the nurses to come to them versus coming into our health center? How do we get our services out at trusted community agencies so that families can feel like they can pull into a parking lot and not be in a government facility? These are ways that, from my staff's standpoint, we're working our hardest to make sure our services are still getting out there. It's not just the right thing to do, but it also gives us peace of mind that we're doing our part.
Kate, you all are holding a lot more weight than ever before, it sounds like. And in the last 30 seconds or so that we have here, I'm wondering, when you think about the next generation of public health workers, what do you worry we're asking them to carry?
It's a significant emotional burden. It's stressful. It's intense. When I hear young people going in to pursue their master's in public health, in my head, I think, wow, good luck, honestly. But outside, I'll say, thank you. Thank you for pursuing this. Thank you for believing that public health can make an impact. And so there's this balance, right, where I worry about people going into public health right now, but we need them more than ever. And we need passionate people who are not afraid to be advocates and to be strong in a system that is a little chaotic right now.
Oakland County Health Officer Kate Guzman, thank you so much for joining me. We'll see you next month.
Thank you so much.
It's the Metro on WDET. I'm Robyn Vincent. Coming up, there are a lot of protests against ICE happening across the country, including here in Metro Detroit. We'll talk about what makes a protest successful. That's next on the Metro. Stay with us.